you have pause there. But here in listening part C, you get pause in the beginning, 90 seconds in the beginning, and then all 6 questions come at a stretch. Okay? And all of them will be multiple choice questions. All 12 questions will be multiple choice questions. The only difference here is in reading part C, you have 4 options, but in listening part C, you have 3 options for each question. So now let us begin with this particular test. Again here, just like listening part B, pre-listening is very, very important. So once you develop the skill of pre-listening, you're definitely going to get very good score. Almost everyone at Acumen passes in the listening test. Almost everyone. Hardly ever, I just can't even remember over the past 2 years that anybody has failed in the listening test. No, it's most easiest aspect, provided that you apply the right strategy, right? And a lot of students have been able to score A as well. So the only thing you need here is right strategy and exposure to the language. You need to be familiar with the language. Okay, so let us look at here also you have the extract, the context sentence. So here it says it is an interview with a critical care physician, Dr. Munro. Now, why is he being interviewed, right? So whenever you listen to a podcast or an interview, why do you have that person on board? Is mainly because they were either involved in that study or a research, or they have found a new way of treating the patients, or maybe they have recently experienced that situation. So here also it says that they have been to Liberia during an outbreak of Ebola. So that is the reason why they are being interviewed. Now let us look at the questions. Here you have mainly attitude and opinion questions, as well as main idea and purpose question. These are the 4 question types that you have in listening part C. You can have the, the most common type is opinion and attitude. It could be opinion and attitude of the speaker, group of people, patients, healthcare professionals. Then you can have purpose question, and you can have main idea question. These are the 3 main common types of questions that you get in listening part C. So as we do it today, I will be helping you understand the different types of questions and how do you approach those questions, right? Both things together. Okay. So here you have first question. The first portion of any listening test will be mainly about the overview, particularly in listening part C, okay? Because first this is just the opening up of the conversation. So see here also what led Dr. Munro to volunteer Ebola patients in Liberia. So why he in the first place decided to go and volunteer there. So he wanted to try out new ways of treating the disease. He felt he had a duty, okay? And he was worried about the scale of the epidemic. Now let us discuss for each of the option what kind of conversation do you expect. So for part A, what do you expect if this is the correct answer? If option A is the correct answer, try out new ways of treating the disease, new ways of treating the disease, and try out, it says. So what do you think? Type in the chat box. What do you think the doctor will be discussing here? If this is the correct answer. The question is basically asking us the reason, isn't it? What led? Led is past participle of lead. So what led him to go and volunteer there? So I have to find out the reason why he decided to go there. So if A is the correct answer, yeah. So maybe he had some new ways of treating this disease. Okay, probably he or his team. Yeah, yes, it could be a new vaccine. Yeah, very good. So it could be a new vaccine or it can be a new form of treatment that he wanted to try out because he might have developed it, but then you need a pool of patients to try it out. So because he wanted to experiment, right? Try out basically means experiment. He wanted to experiment those methods with the patients. Yeah. Then B, if B is the correct answer, he did not have any such selfish, intention, but he did just because he thought it was his responsibility. Yes? And that is the reason he did it. And what do you mean by scale of the epidemic? Scale of the epidemic. If this is the correct answer, what kind of data do you expect here? See, again, I would warn you that this part is the beginning, and therefore you would hear, about ways in which it can be treated. You would definitely hear about, how many patients there were affected by it. So if C is the correct answer, what do you expect? Scale of the epidemic? He wanted to prevent or stop it there, but how would I identify he went there because of scale of the epidemic? What do you mean by this phrase? Scale of the epidemic? Number of patients. Yes. Yeah, it could be the proportion or number of patients who get affected by it. Yeah. Okay, so this is typically a detailed question where you have to specifically find out why he decided to go and practice there. This detailed type of question is very, very rare. Out of 12 questions, you could have one or two questions which are detailed types of questions. But usually in the beginning, it would be detailed type of question because beginning would be just an overview of the entire topic. Okay, and let us look at the second. We will do two questions at a stretch here. Second question, what attitude was prevalent amongst Ebola patients? You can clearly see that this is an attitude question. Yes, but attitude not of Dr. Monroe, but the patients, isn't it? What attitude was prevalent amongst the Ebola patients that he encountered? Again, look at the answer choices. Pay attention to negative words. Mistrust of medical intervention, unwillingness to come to terms with the disease, and a belief that treatment was best administered within the family. Do you see any similarity in the answer choices? Do you see any two answer choices which are very close to each other, and one answer choice which is slightly different than the other two? A and C? Yeah, A and C are quite close because they both talk about treatment. Do you see this? intervention and intervention. And both the options tell you that people were not very happy with the intervention that were taken by the medical fraternity, because A also says mistrust of medical intervention, and C also says it is best administered within the family. That means they did not trust the medical interventions that were administered in the institution or the standard medical therapies. Whereas B mainly talks about the disease itself and not the treatment. What do you mean by this phrase? Come to terms with something? Come to terms with something? What does it mean? Accept? Yes. To come to terms with something means to accept that situation, to accept the reality. For example, now we all have come to the terms that we have to live with corona. We don't have any other alternative. So here it says unwillingness to come to terms with the disease. That means they were not willing to accept that situation. Okay? So what we are going to do now is I would play this audio. You would answer these two questions. One is a detailed question where you need to find out why he decided to go and volunteer there, particularly the reason for it, not the summary of whole conversation. But in second one, because it is an attitude question, you have to go for a summary of how the patients thought about it. So they would not straight away say that the patients were not willing to take treatment, they were not willing to accept it as a disease, but you would have to infer from whatever is being explained there. Yeah, and both the questions will come in sequence, but because it is an interview, so after Dr. Munro has answered one question, the interviewer will ask a next question, and that is the time when you would move to question number 32. The interviewer will be just facilitating the whole interview, so you don't need to pay much attention. Like your answer would not come from what the interviewer is saying. You are going to focus mainly on what Dr. Munro is saying. But interviewer will help you to navigate through the questions. The interviewer will help you how the interview is progressing further. Okay. So first two questions.
Today we're speaking to Dr. Kyle Munro, a critical care physician who went to Liberia as a volunteer in order to treat patients during an outbreak of Ebola. Dr. Munro, tell us a little about Ebola and explain your reasons for volunteering.
Sure. Ebola virus is a severe, often fatal illness. Without treatment, 9 out of 10 people who contract the virus die, many from dehydration, hyperbulimia from excessive vomiting, loss of nutrients due to diarrhea or organ failure. The disease was reaching epidemic proportions in some areas, so outside help was needed. The irony is that the necessary medical care is relatively simple by modern standards, and I felt a kind of moral obligation to go and ensure that it was provided. Saving lives might require as little as clean IV needles, fluids, and basic lab tests, things we take for granted in resource-rich parts of the world where they're at our disposal all the time. That isn't always the case in remote parts of Africa, where supplies can be scarce and the necessary expertise lacking.
And how did the patients you were treating respond to your presence?
Well, to give you some sort of idea of what we were dealing with, the first 2 patients I treated were a brother and sister. Both had developed Ebola symptoms, which often presents like flu, with fever and pain, and straight away they fled to the bush because they were fearful of what might happen to them if they were treated. They were found quite quickly because they were too weak to run, but even with treatment, both later died. Indeed, such was the fatality rate that 9 out of 10 people who entered our treatment facility were never seen again by their family members. So you can see what those attitudes were based on.
And is it
Okay. Now I'm playing it for second time for 2 questions.
Today we're speaking to Dr. Kyle Munro, a critical care physician who went to Liberia as a volunteer in order to treat patients during an outbreak of Ebola. Dr. Munro, tell us a little about Ebola and explain your reasons for volunteering.
Sure. Ebola virus is a severe, often fatal illness. Without treatment, 9 out of 10 people who contract the virus die, many from dehydration, hyperbulimia from excessive vomiting, loss of nutrients due to diarrhea or organ failure. The disease was reaching epidemic proportions in some areas, so outside help was needed. The irony is that the necessary medical care is relatively simple by modern standards, and I felt a kind of moral obligation to go and ensure that it was provided. Saving lives might require as little as clean IV needles, fluids, and basic lab tests, things we take for granted in resource-rich parts of the world where they're at our disposal all the time. That isn't always the case in remote parts of Africa, where supplies can be scarce and the necessary expertise lacking.
And how did the patients you were treating respond to your presence?
Well, to give you some sort of idea of what we were dealing with, the first 2 patients I treated were a brother and sister. Both had developed Ebola symptoms, which often presents like flu, with fever and pain, and straight away they fled to the bush because they were fearful of what might happen to them if they were treated. They were found quite quickly because they were too weak to run, but even with treatment, both later died. Indeed, such was the fatality rate that 9 out of 10 people who entered our treatment facility were never seen again by their family members. So you can see what those attitudes were based on.
And is it true you had to wear a lot of specialised clothes?
So now I would want you to type in your answers. Okay, so those who decided to go with A for, okay, so that A is for 32. And for 31, either B or C. Yeah. So let me discuss this with all of you, right? Did he talk about any new form of treatment? Any new form of treatment? No, in fact, he explained how just the simple IV needles, okay, and IV sets will be required to treat the patients. If I show you through the answer, through the transcript, in fact. Can you see it here? It says that the disease was reaching epidemic proportion. So that is true. As I told you, this is first part of the test. So they would also describe some basic data about it. But he explained that the necessary medical care is relatively simple by modern standards, and I felt kind of moral obligation to go and ensure that it was provided. And then he explained that it would require simple IV needles and basic lab tests and fluids. So it was not a very fancy treatment that one had to give, and nothing about new treatment that he wanted to try there. You know, that he had some new medication which he thought he would go there and try out to see if it is helping the patients in any way. No, it was definitely not about A at all. And he said that he felt kind of moral obligation, so that is B. B is the correct answer here. Okay. So the disease was reaching epidemic proportion, but was it the reason why he decided to go? We were looking for reason why he decided to go and volunteer there. Okay. For second one, I can see a lot of you have gone with A, B, and C. Okay, again, all three. Yeah, let us discuss. So definitely, he did say that the patients were not willing to take treatment, right? He gave an example as to how those patients, which he was describing, fled in the bush. They did not take treatment. Right here, because they were fearful of what might happen to them if they were treated. So people did not have enough trust on the medical intervention. Okay? And they were found very quickly. So they were found, but still they died later on. So it's true that people were not trusting the medical intervention. But how can we rule out C here is because nothing about treatment within the family. It didn't say that people were willing to take those herbal medicines, or people thought home remedies would work, or people thought certain kind of diet would work. In fact, they fled to bush. That means they did not take treatment at all, not even the treatment that can be administered within the family. So A is the correct answer, mistrust of medical intervention. Okay? Nothing about accepting the disease itself, because as soon as they were diagnosed, they fled to the bush. That means they accepted that there was something wrong with them. The main conversation is about their willingness to take treatment. I could show that again to you. So even after taking treatment, both of they died. And that is why the speaker also agrees why people were worried. So he explained first what kind of symptoms, but they went to bush because they were fearful of what might happen to them if they were treated. So they were fearful about the treatment, and then he himself acknowledged that it was natural because the fatality rate was very high, and the patients who entered in the treatment facility were never seen by their family members again. So everyone thought that they were dying because of going into the hospital rather than being recovered from the treatment. They were getting more ill. Okay, so this is again like your pre-listening and how you interpret the question that plays an important role. Now let us look at next two questions. And here, first I want all of you to read it, and then I'm going to ask all of you to explain me what do you think is the focus of each question and each answer choice as well. And what do you predict would be the type of conversation in this part of the test? And what would be the conversation if that particular answer is correct? What do you predict? Okay. So go ahead with the reading the questions, and then I'm going to ask each one of you to answer it. You can put your microphones on when we discuss it. And also try to identify the differences amongst the answer choices, how answer choices are different from each other. Try to highlight negative words if there are any negative words in the answer choice. So again, this is opinion question where you have to find out opinion of Dr. Munro about specifically the specialized clothing that they had to wear during this or while providing treatment. So you have the negative words, unnecessarily uncomfortable, their own health was affected, or it was affecting the ability to treat patients. Okay, so can I now ask each one of you? Let me start with Pankti. What do you think if Pankti, if A is the correct answer, what kind of discussion can you expect here? Unnecessarily uncomfortable?
Maybe he feel uneasiness and not
Uneasiness.
feel comfortable.
And what does this unnecessarily mean?
Means they feel uncomfortable or uneasiness that may not be necessary.
What may not be necessary?
Whatever they feel, uneasiness or uncomfortable, maybe they're
No,
not.
how uncomfortableness cannot be necessary or necessary. It's, you feel uncomfortable whether it is necessary or not. It says it was
Maybe feel
unnecessary.
or maybe not feel.
No, unnecessary means whether you need it or not. So can I choose whether I can feel uncomfortable or not? No, I can't choose it, right?
Maybe they feel or not feel.
No. Unnecessarily uncomfortable. That means he thinks that those protective gears that they were wearing, they were uncomfortable and they were also unnecessary. There was no need to use such protective gear, in his opinion. Doesn't it mean that? Yeah, because uncomfortableness cannot be necessary or unnecessary. The protective gears that they had to wear can be necessary or unnecessary. Okay. Then for option B, his own health was affected by having to wear it. So here, can I ask Krishna to explain?
Uh, Maybe by wearing some kind of unpleasant, like sometimes we have to wear a tight mask. Due to that tight mask, we get rashes on our nose.
Hmm.
That.
Yes. So some impact on their health
Hmm.
because of it. Okay. And Dr. Kathan, can you tell us what do you expect from C?
Yes, yeah.
Hmm.
So because he had to wear that uncomfortable clothes, that might affect his ability to treat the patient. He was not able to treat the patient how efficiently he could treat in normal
Yes.
condition.
So it somehow affected his ability to treat the patients. Maybe less physical contact with the patient, or not being able to touch the patient, not being able to feel the patient's kind of, when you touch the patient, you can actually feel. A lot of physical assessment that you do also depends on this, that you actually touch the patient. For example, checking their temperature, checking pulse for the patient. So this kind of things can be interrupted because of it. So do you notice one thing, that all three options are negative in some way, right? At least you can make out that he was not very happy about wearing those protective gears. Now what you have to find out is whether he thinks they were not necessary, whether he thinks that it was affecting their own health. Was that the concern for him? Or whether he was concerned about his ability to treat patients? We have got so far know that, definitely something was wrong about the protective gears. Now, in what ways it was wrong, whether it was completely unnecessary, he thinks that they could have worked even without protective gears, then A is the answer. Otherwise, it could be B or C. Okay. Then 34. Can any one of you tell me what kind of question is this? This is very, very common of listening part C, where they would go on to give a presentation or case presentation about a particular patient.
What?
Yes.
What kind of question is this?
Opinion question.
No, this is not opinion question. Kishan, you said something?
Is
What kind of question do you think it is?
about you can say idea
This is purpose question.
purpose.
Purpose question, because see, it is telling us that he is giving out a story of a girl called Emma, but what is he trying to highlight? Yeah, what is his intention? What is he trying to prove with this story? So that is typically purpose question, where the speaker may go on to give or describe a study or statistics or experiment or a particular patient, and then the question would ask us, what is he trying to prove? Why is he giving this example? Right? So here also it is given that he's trying to highlight something with this example. So you should not go or you should not be taken away by the example itself. You have to think, why is he giving this example? What is he trying to prove with this example? So even young children were at risk. Is he trying to prove that? Tragic individual stories were? Is he trying to show how tragic the stories were? Or how single-minded medical staff had to be? What do you mean by single-minded? Focused, emotionally.
Have to follow
Yeah,
something.
yeah. Single-minded means when you are focused on one thing and you're not getting distracted by the emotional disturbances or the kind of situations that occur when you are in such an epidemic and when you are treating the patients out there. So here, when it comes to purpose question, it's very, very important to pay attention to what the interviewer is asking. Yes, because interviewer has asked a question and then the doctor is going to give one example to answer that question. So listening to interviewer can also be very helpful when you are dealing with purpose questions, so that you understand what is he trying to prove to this example, what is he trying to explain to this example. Okay, so now I would play these two questions, 33 and 34.
Clothing while treating patients with Ebola.
Yes, that's correct. It's a little beyond the traditional white coat a lot of patients associate with doctors in a hospital setting. I would wear my scrubs, and then I would put on a pair of thick rubber boots that came up to my knees. After that, I had to get dressed in a bodysuit, then 2 pairs of gloves, a face mask, a hood that covered my neck, and finally goggles. The overall impression is similar to that of a spacesuit. In the tropical heat and humidity, it was suffocating. You lose about 3 to 5 litres of sweat, then spend the next 2 hours hydrating before you go back in. It does limit the level of care you're able to provide because it prevents you from physically contacting your patients, and that reduces the amount of sensory input we usually get as part of our jobs as physicians. But it also saves your life.
And is there a particular case that sticks in your mind for any reason?
Yes, one particular case involved a young girl, let's call her Emma. She was part of a small cohort of patients we had to deal with where someone in the family would test positive for the disease and someone else would be negative. And once a patient had tested negative, they had to leave the unit for their own safety. The little girl was 6 years old and she'd contracted the virus, but her mother hadn't, so I had no option but to escort her away. They were both terrified about what lay ahead of them. The girl died 4 days after they were separated, but her mother survived. I think, in some ways, this story really brings home to me just how awful things could be during this outbreak. You know, the kind of personal tragedies that people had to live through.
You're back
Okay, so okay, so let me this time do it the other way around. Punky seems quite confused. A, B, C, all three options. And question doesn't seem to have answered 33. You can only see your answer for fourth one. Okay, yeah, third you have written C and fourth is B. Okay, that's great. Okay, so a lot of you could get 33 correct, which is C for sure, because um, he definitely did not say it was unnecessary, right? You could clearly hear when he said that it saves lives. So definitely it was uncomfortable for him, but I had to get dressed in a bodysuit. Okay, the overall impression was like a spacesuit, and it was very difficult. They used to sweat a lot, and then they had to hydrate themselves. But the point he was trying to make is it does limit the care. Remember, I have suggested this before as well. Whenever you're trying to emphasize something, you would separate do and does from the verb, even if you are making a sentence. Usually, when do we separate do and does is when we are making a question. Do you like it? Does she like it? But in sentence, I would I would rather say I like it. But if I say I do like coffee, I'm trying to emphasize it a lot. So here also he says instead of saying it limits, he's saying it does limit. So that is something he's trying to emphasize. Okay, but it also saves your life. So it saves your life. That is something that helps you to rule out A. A says unnecessary. Does he think it is unnecessary? No, because it saves your life. So it tells us that it is necessary for him to wear it. It is uncomfortable? Yes. Was it affecting any way on their health? No. They just mentioned that they had to drink a lot of water because there was a lot of humidity, and because of that they would perspirate a lot. But nothing about the impact on their own health because of it. Okay, and 34, I can see all of you have got quite confused between options B and C, right? So, yeah, so he did explain, how horrible the stories could be. But what was the question asked by interviewer is that, is there any case that sticks to your mind? Okay. And then he explained this story of the girl, which actually was quite a tragic story. But what he was trying to prove through this is that the healthcare professionals, because he also explained the take home message for him. Can you see here? That the take-home message for him, I think in some ways, this story really brings home to me just how awful things could be during this outbreak, the kind of personal tragedies that people have to live through. So what he has learned through this, that was something he was trying to highlight. Not just how tragic the stories could be, but how he had to work in that situation. Because the question was also asking him to explain something that he still remembers about his experience. Right, so we did three types of questions. We did one opinion question, one attitude question. Attitude and opinion is more or less the same strategy that you use. We did one purpose question and one detail question. Now, main idea question will be getting the overall idea. Okay, so look at this. Now, this is a main idea question. Treating Ebola patients in Liberia has made Munro. So, what is this question asking? How it has changed him, isn't it? How he has changed after treating the patient. And Dr. Munro explains that Ebola may spread to other parts because, so here also I have to get a gist of what is being explained. I'm leaving the keywords on to you. Okay, so I'll give you 1 minute time to read through the answer choices, and then I would play it straight away without discussing the answer choices further. Always try to identify the difference between the answer choices, whether they are negative or positive, whether they are on a particular topic. Okay, now I'm playing this part.
Home now. Do you think you approach your job here any differently now as a result of the work you did in Liberia?
That's a good question. I do think it's made me more sensitive to how important it is to make a real connection with your patients. One of the things we had to do for our patients in Liberia, in addition to just trying to blunt the worst effects of an appalling illness, was also to try and manage their anxieties and fears. I'd like to think that I'd been aware of the need to do that before, but now I think I understand the principle behind it in an entirely new way. And that's informing the work I do with my regular patients back home.
And do you believe Ebola is something the rest of the world should be more concerned about?
Well, I know the disease has spread further, and I'm not surprised. In a recent case in Nigeria, a man infected with Ebola collapsed at a crowded international airport. He later died, and the authorities had to closely monitor nearly 60 people he might have come into contact with. The majority of people think that Ebola is a dramatic disease that kills people in no time. The reality is that the incubation period is 21 days, and because the disease can spread from one infected person to another person via direct contact with blood or body fluids, the potential for spread outside of West Africa is there. Good infection control should prevent this happening.
So this time I just want to open up this forum and I want all of you to discuss it with each other. For example, some of you have in 35, some of you have chosen A as the answer. Almost everyone has chosen A. So, okay, nothing to debate about 35. In 36, some of you have chosen B, some of you have C. So, yeah, can we discuss that? Those people who have chosen B, can you explain us why B, and those who have chosen C? So let us start with those who have chosen C. Can you tell us why have you chosen C as the answer? Why did you choose C as the answer?
Yes, ma'am. He told if anyone person in the crowd, they can easily transmit this disease.
Yes. So we did hear, one person who collapsed in the crowd, and then they had to quarantine the rest of the group. Okay, so how those people who have selected B would defend them? Can you explain them? Why have you chosen B, or how did you rule out C?
He explained. Okay. Incubation time is longer than they think. Approximately 28 days, something. Incubation time is longer.
And it is caused by like blood or body fluid contact.
Yeah. Kathan, you were saying something?
Yeah, so people think that Ebola is a dramatic disease.
Yes, people think that it can develop in no time, but it is in fact, yeah, longer than people think. So this is very, very important. Okay, always keep an eye on answer choices which are making comparison. So here you can see comparison that because of plane travel, it will spread much easier. Incubation period is longer than people think. And yeah, they did talk about a person who collapsed in the crowd, but then they explained that it spreads mainly through the body fluids, right? So it doesn't spread through the aerosols, or it doesn't spread through, it's not basically an airborne disease. Yeah, so here you can see that he explained that a person was in a crowd. He was in a crowd. He was at a crowded international airport. So again, here it was not a crowd, but they have said crowded international airport. Okay, and then he collapsed, and he later died. And because of that, people had to be monitored. But then they made it clear that it spreads through direct contact or blood or body fluid. Whereas if you look at the answer choice, it says it can spread in the crowd. So if it is with direct contact or if it is with body fluids, it cannot spread in the crowd, right? Only those people who physically touch the patient would get it, or those who have directly come into contact with any of the body fluids would get it. So that helps me. So basically, again, just going by one word will be the worst case scenario. If you would go just by one word, 99% of the time you would end up choosing wrong answer. So go for the overall idea. You need to actually tune into what is being discussed there. And that is the reason why so many practice tests have been given to all of you, and that too in a level, so that when you are doing beginners, they are comparatively easy. As you move forward to intermediate or advanced, you move on to the toughest test. The advanced is the real difficulty level. That is the reason when you would be preparing for your final exams, you would practice from advanced, so you can practice with the actual difficulty levels. They are the test papers from the most recent exams.